keeping you informed of the issues impacting your daily life. This is a legislative update from the Florida Capitol from AFSCME Council 79. With only a few weeks remaining in the 2010 legislative session, AFSCME takes the fight to the Florida Senate in an effort to protect state employee pay and retirement. The House passed a $67 billion budget that would cut state employee pensions and pay by 3%.
It's very serious. They need to be looking at the retirement bills, drop bills, talking to their local legislators about those two bills, anything dealing with their insurance benefits. Money in this state's very tight, as you know, and so they need to be watching and reading the paper. Retirees need to be looking at their health benefits, and just everybody looking at the budget as it goes forward and keeping up. Well, anytime you mess with your public sector employees, you're messing with everyone. These are the people that provide your services. If you go to a line to get your driver's license renewed, you don't want to wait 2 or 3 hours to get that done. So everything that happens affects everyone. We just don't see it on a daily basis, or sometimes it's not the focus. But someone's picking up trash, someone's driving your children to school, someone's feeding your children in a cafeteria line. There's never been a more urgent time than right now to contact your local legislators.
The House budget plan would eliminate the monthly retirement stipends for insurance, breaking the pledge to give public servants what they have earned.
Joe Lama, who goes to my church, he worked for the state for 30 years. His final salary at the Department of Education was $24,000 a year. His pension is $12,000 a year. They're talking about taking $1,800 away from him. They're talking about taking almost 15% of his retirement income away from him when he qualifies for low-income programs such as Meals on Wheels.
The AFSCME team succeeded in stopping the assault on public service by a 59-57 vote, but the Speaker pushed to reconsider the vote.
Last week, the work that all of us have been doing caused the Florida House of Representatives to vote down the retiree health insurance subsidy. The Speaker of the House had to twist arms just to pass it. However, 15 Republicans crossed over, joined every Democrat to vote down this bad proposal because many of them out there know that they have problems when they try to pass laws, pass a budget that's going to be taking money out of the pockets of low-income retirees and working families.
Contact Senate President Jeff Atwater and let him know that the House plan is not one that works in the public's best interest.
Call 1-866-580-3030. That will put you through to Jeff Atwater's office. He's the Senate President. He's in a position of influence to be able to stop these bad proposals. So everyone should call 1-866-580-3030. That's a toll-free call for you to tell the President of the Senate, Jeff Atwater, not to balance the budget on the backs of retirees and working families.
As promised, we talked with one of many public employees who works vigorously to protect the public interest. Meet psychotherapist Andre Austin of Orlando. He evaluates inmates, many of them dangerous.
Yes, it is, because we also have to determine, like when sometimes those people are getting out of jail, we have to determine whether that person meets Baker Act criteria or not, whether that person is stable enough to go back to their community, or whether they need to be in a secure facility for psychiatric stabilization. And sometimes people they're hearing voices, or they're homicidal, or very depressed and suicidal. And it's our job to make sure those people get the correct care, and we protect Orange County as well from lawsuits, from family members when if something is you don't have the correct professionals in there doing that job to make sure that those people get the correct care.
And I guess the public doesn't understand that a lot of times when they start talking about cutting public employees, they're looking at a guy like you that could save their lives. Is that, how would you define it?
I would say you're right on target. And it's also a safety issue for the other staff that are working there, the corrections officers, the other nurses. When we can identify somebody who is very unstable and needs to be in a secure cell by themselves until we can get them psychiatrically stabilized. That person could hurt other people as well as themselves, and as well as them going to the street if they're not psychiatrically stable and hurt themselves or hurt other people.
Let Andre know you appreciate his dedication to the public interest. Stay connected to the Legislative Update, your connection to the issues impacting your life.